Hi guys, and welcome back to my channel. Firstly, I want to say a huge thank you to everyone who has watched the update on Cohen and who has commented and liked and subscribed. It's grown dramatically, and I'm really excited to be able to one, share his story because it makes it good for me to talk about, and also to build some awareness about osteosarcoma because there's not much awareness out there about it, hence the delayed diagnosis in most cases. So this video is going to be a little bit different. I've got some vlog style footage to insert for you. I've been doing little bits of videoing of Cohen throughout the last month. So where we left off last time was that Cohen had just gone to school. And I showed you that. Then we went down to clinic for just bloods and stuff like that, and we came back home, and that was on the Tuesday, and he came back home and he went to school on the Friday, which was the last day of term, which he was really excited because he was going to be at home for school holidays, which meant that we could do some stuff as a family and he could have some friends over and things like that, which he hadn't been able to do because it hadn't lined up and he hadn't been well enough to do that kind of thing. But this school holidays he was going to be okay. However, due to the COVID situation, Sydney, New South Wales and the Sydney metropolitan area, which also included the Central Coast, went into a 2-week lockdown, which meant that we were in lockdown for school holidays, which meant that Cohen couldn't have any friends come over for sleepovers, or we couldn't go out and do anything as a family, which was extremely disappointing. And it was really hard for me as well, being so isolated and not being able to have friends and family come around and be supportive. It's always nice to have someone to come around and give you a bit of support when you're going through a lot of stuff. But we've managed to get through day by day, and we're still in lockdown. But I'll continue to add the vlog footage for you and you can see all of that. But before I get into the vlog style of things, I just want to let you know, at the end of his second cycle of the clinical trial, which is what we're at the last video, he had a CT scan just to see where he was at with the tumours on his lungs, and at this stage it's looking quite promising. The tumours on his lungs have not changed, which we're taking as a win because they haven't grown, whereas in the last lot of treatment they had actually grown slightly. So yeah, it's a little bit of exciting news, which is nice. So we just keep going ahead, and I'll insert the vlog footage that I've got here, and then I'll come back in and I'll chat to you about some other things that have happened through this cycle. Doing a bit of creating for C2 for some new products coming out. Just entertaining myself while Coco has his chemo. Hope you're all having a good day. After we got the results of the CT scan, which was the great news, Cohen started his third cycle of the clinical trial, which always starts with with 3 days of intravenous chemotherapy. So we did that, and then we were in for 3 nights, and then we get to come home on the 4th day, which is really nice. So we came home as really normal, uneventful cycle, which is always nice to have.
1 second.
Sitting in the hospital waiting for his bloods to be done. May need to have a transfusion today, but we'll see. Today he decided he wanted to make some nana bread, so that's what he's doing, mashing him away. Even though his bloods are very low, he still wants to make banana bread. Not exactly where we wanted to be today or last night, but when your bloods are really low and you end up with a sore throat, the hospital's the place you end up. So hopefully we get out of here sometime soon. So as you would have just seen, we actually ended up back in the hospital just locally here on the Central Coast because we came home and after having his bloods done and making banana bread, and Cohen developed a bit of a fever, so his temperature went up to 38.9, which is a little bit scary, especially when his bloods were so low, and he also had a little bit of a sore throat. So we went to the emergency department. So he was in we went in on the Thursday night, and he had blood transfusion and platelets on Friday, and then we came home on the Sunday, which was actually quite good. So no infection had developed or anything like that. It's just because of his sore throat and his temperature, they just have to, it's a precautionary measure. So yeah, he's doing really well after that. Yeah, he's doing really well. But whilst we were in Wyong, we noticed that there was a little bit of a sore on his left leg, on his surgical scar. And they weren't overly concerned about it. It had a little bit of clear ooze, but nothing to be too concerned about at that stage. So they cleaned it and dressed it, and we were sent home to pop back up to our local hospital here, where we go and have bloods done and everything like that. And when we go and have bloods done, they checked the wound, and it was all healing really well. So it looked all good on the surface. Currently in lockdown, so medical appointments have been a bit juggled around and stuff like that, which you'll see we start wearing masks again in this video. So we came back home from the hospital and went up and had his bloods done at the local hospital as normal, and then also had his dressing checked. And also that day, Cohen had his physio via Zoom, which was really quite cool. So he's actually now got a 90-degree bend in his leg, which means that he can sit normally and is walking a lot better with his brace on. So it's really, really good. He's making great progress. So Cohen has his chemo whilst he's at home, and I keep an eye on all of his wounds and his dressings and that sort of thing. And on Sunday, sorry, I'm just double checking the date, the 25th of July, he called me into his room because the dressing on the small wound on his leg was showing a little bit of bleed through. So he'd taken the dressing off, and his wound had become quite substantial underneath. So I booked an appointment to head back up to our local, it's called the Pediatric Assessment Unit. So we headed up there on Monday so that they could have a look at it and everything. So we popped up there, and it looked like it had, it's a little bit oozy, but it wasn't anything untoward. So they took a swab and everything like that and re-cleaned it and dressed it after I had done it. They didn't really want to. They wanted to leave it as I had done it, but I asked them to redo it. So they re-cleaned it and redressed it and everything, and then we were due to head down to Westmead Children's Hospital to have for him to do chemo on the Tuesday, which is the Tuesday just gone. So yeah, we went down there, and we did our normal clinic visit and everything like that, and we were admitted for chemo. And I've got some vlog footage of us down there, so I'll insert that here. So we've come in for routine chemo today, and we've had a few little setbacks. We've actually been told that they're stopping the chemo because Cohen has a wound on his leg that has opened up and needs a bit of attention. So we're off to have an x-ray and an ultrasound, and they've started him on some antibiotics. So just a little bit of a setback, but Cohen seems to be doing okay, and yeah, he's not in any pain or anything. It's just a bit of a setback for chemo. So Yeah, so this is I won't show you because it's a bit oozy and I don't want anyone to be grossed out by it. But yeah, it's just a wound that's developed from a pressure sore, but they think it might be under the skin. So as of last week, it was just a little nothing and now it's bigger. So, but Ko's doing okay, aren't you, Ko?
Yeah.
You doing okay? Say hi. As you saw in the vlog footage, they decided to stop his chemo after speaking to his tumour surgeon, and they just, because they have to stop the clinical trial that he's on 2 days prior to any surgeries, just because they can interact and they need to make sure his bloods are all at a good level. So he was booked in to have surgery and to clean out the wound because it had gotten deeper really quite quickly, so they're actually concerned that it was actually more under the skin, as I mentioned in the vlog, in the other footage. So yeah, so they're just going to go in and give it a bit of a clean out, which is what they did on. So unfortunately, Cohen's surgeon wasn't able to come and see him before the surgery, as he was a close contact, so he was in isolation himself, but luckily his isolation ended, so he was able to come on the Saturday and do the surgery on Cohen's leg, which made me a lot more comfortable because he was the one who did the original surgery and he knows exactly what's going on inside, and I didn't want anyone else messing around with it, so we were really happy that he was able to come and do it. Waiting in the recovery room. He's just had his surgery on the abscess type thing on his leg, so I'll give you an update when we come out. So apparently it all went well, but we're just waiting, so I'll chat to you all soon. So due to the wound on Cohen's leg and the fact that he was going to go into surgery, I'm just trying to work out the best way to explain it. The wound on Cohen's leg, it's actually under where his Zimmer splint, so which is the brace that he's wearing to support his leg while he's in doing his physio and builds up his strength. That it's where the main foam and clasp holds that holds the Zimmer. That's where it rubs on his leg, which is what they think has caused the slight pressure sore. So our biggest concern was that once they did the surgery to do the debridement and clean it out, that he putting the brace back on would rub on the stitches and he wouldn't be able to wear the Zimmer. So I actually asked if we could speak to his physio in regards to him not needing to wear the splint anymore when he was walking, and so she came, and I'll insert the footage and show you. She actually came and to see whether Cohen was capable of walking without the brace and whether he had enough strength, and he's actually now walking without the Zimmer brace on, which is brilliant, which means there should be no reason why his healing isn't completed within the 2-week period. So that's also a major stride for him because it means he doesn't actually have to have the brace on, which is quite encumbering because he can only bend it to whatever degree they had it set at. So now he's actually walking pretty much normally, which you would have seen by the footage, which is really awesome. So yeah, so Cohen now has 5 stitches in his leg and his chemo has been stopped for the next 2 weeks so that he can heal completely and make sure that we don't have any other issues with wounds opening up and scars opening again. So unfortunately it's just one of the things that can happen when they're on chemo, because their blood's levels and their platelets get so low that their body just doesn't heal the way that it normally should. So yeah, so we're back home now and just looking forward to some family time and for me to get back in to my office. As I said, I will be doing some more DIYs. I have actually been doing some crocheting whilst I was in the hospital. One of the bits of footage I'll insert is actually me in the hospital just doing some crocheting and keeping myself entertained whilst in the hospital. So once again, thank you, and if you want to keep up to date, please hit the subscribe button, and if you hit the little bell notification, it'll notify you when I post any updates. And thank you once again.